So you want to know if prostate cancer has early warning signs. Well, in this video, we're going to learn all about whether or not prostate cancer has early warning signs. Welcome to Health Drum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health, so you can be informed and in control of your healthcare needs. So if this is your first time on the channel and you like fact-based healthcare details and not fiction, go ahead and subscribe below. By the way, Health Drum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. So let's get into it. Does prostate cancer have early warning signs? And sort fact from fiction. So this is a list of symptoms that are commonly claimed to be early warning signs of prostate cancer, but these claims are all fiction. These symptoms of poor stream frequency, dribbling, burning, pressure discomfort, blood in the urine or semen, erectile dysfunction or impotence, painful ejaculation, lower back or pelvic pain, weight loss and fatigue are not early warning signs of prostate cancer, but symptoms related to benign enlargement of the prostate and aging, and not the tiny cancer buried within the prostate. So one of the reasons that healthcare is plagued with misinformation and fiction is because it's financially driven. So let's check some more so-called facts about prostate cancer. So the prostate cancer arena is full of marketing exaggerations and half-truths, such as 1 in 8 men will be diagnosed with prostate cancer in their lifetime, that you should check your prostate if you have any urinary or sexual symptoms, that early detection allows early treatment, and that early detection allows less aggressive treatment options, as well as lowering the chance of death and offers a better chance of cure. These marketing claims are not facts but fiction and merely recycle misinformation about prostate cancer. In fact, there's no irrefutable and reproducible evidence to support any of these claims. And again, I have links to this material exposing all this fiction in the description below. So where is the prostate exactly? So here's an image of the prostate side on. It's located just below the bladder, and the urinary channel runs from the bladder base right through the middle of the prostate and out through the urethra. You can see that the prostate is adjacent to the rectum, so that the prostate can be easily felt using a gloved and lubricated finger to enter the rectum and examine the texture of the prostate. So if you see the doctor and complain about some urinary or sexual problems, they're going to recommend almost invariably 2 very unreliable tests: the prostate check or exam and the PSA blood test. So the prostate exam or check is highly unreliable. It's a test where the practitioner tries to feel if there's any firmness, induration, or nodules in the prostate. In order to detect these areas, the nodules need to be a certain size before they can be detected. However, most prostate nodules are benign and due to BPH and prostatitis and so on. Only a few prostate nodules are cancerous. And it's important to realize here again that only some 10 to 15% of prostate cancers are high grade and potentially deadly, whereas most prostate cancers are outlived. So the test commonly recommended after the prostate exam is the PSA test. How reliable is that test? So the PSA blood test has a 78% false positive rate, and it's not specific for the prostate or for prostate cancer. Its levels of 0 to 4 as being normal are bogus, and the PSA cannot distinguish between cancer and no cancer, or mild cancer and aggressive cancer, and high risk or high grade cancers often produce little or no PSA. Although the PSA was FDA approved in 1994, it is a highly unreliable screening test for prostate cancer. As well, many high-grade prostate cancers often produce little or no PSA. So there are no early warning signs for prostate cancer, and the prostate exam and the PSA are highly unreliable, what test is usually recommended next? So although the PSA test and the prostate exam are highly unreliable, if one or both of these tests is deemed abnormal, you will almost certainly be advised to have a prostate needle biopsy. This also is a highly unreliable and risky test. Shockingly, the 12-core biopsy is considered standard of care, but samples blindly and randomly only about 0.1% of the prostate. This means that the practitioner is absolutely clueless about what's going on in 99.9% rest of your prostate. Even worse, many prostate cancers are multifocal, meaning that prostate cancers can be present in several areas of the prostate and not necessarily all at the same time. There are several techniques for doing the needle biopsy. The most common techniques are the ultrasound-guided transrectal or transperineal biopsies. Both needle biopsy tests are highly unreliable because of the huge sampling errors, but the transperineal is less risky with less septicemia. The most reliable prostate biopsy approach is an MRI-guided prostate biopsy of a suspicious area. However, this test is not commonly done by urologists, as they commonly do the MRI ultrasound fusion biopsy, but this is not as accurate as an MRI-guided biopsy. So, in addition to all the claims about why you should get your prostate checked, you will also come across material about prostate cancer risk factors. So there are some risk factors associated with prostate cancer. Prostate cancer increases with age, so that approximately 50% of 50-year-olds will have some cancer, 60% of 60-year-olds, and so on. However, most of these prostate cancers will be outlived. A family history of prostate cancer may increase your risk, and men of African American heritage may have a higher risk of having prostate cancer. In addition, obesity and certain lifestyle choices also seem to increase the risk of cancer. And although we're talking about the increased risk of cancer, nobody's really clear as to what type of cancer is involved with these increased risks. However, it's very likely to be low-risk cancers that will be outlived. And if you're interested in preventative measures to counter these risk factors, lifestyle choices with moderate amounts of regular exercise and a plant-based diet may lower the incidence of cancer. And speaking of outliving most prostate cancers, the Gleason 6 is still labeled as a cancer, although it's been known for many years that its biological pathways for cancer development and cancer spread are inactive, and that the Gleason 6 cannot behave as a cancer. So to recap, urinary and sexual symptoms are not early warning signs of prostate cancer. The prostate exam is highly unreliable. The PSA blood test is highly unreliable. Prostate needle biopsies are highly unreliable, and only about 10 to 15% of high-grade prostate cancers are potentially deadly. To learn more about routine medical conditions, self-care, and digital health, check out these other videos.